Hello dear listeners! Today we will talk about bleedings, their types, and how to act in first aid. Bleeding is the penetration of blood outside the vascular channel into the environment, either in the body cavity or the lumen of the organ. The volume of circulating blood in adults, depending on the body weight, is about 5 liters on average. In newborns, 200-350 milliliters. Blood is the body's life-supporting fluid that participates in all metabolism types: oxygen and carbon dioxide transportation, water distribution, and products of vital function removal. The main reason leading to death from bleeding is a rapid decrease in circulating blood volume. In adults, it is 30% of the total blood volume, approximately 1.5-2 liters, which can be compared with the volume of Coca-Cola bottle. Therefore, in life-threatening situations, it is necessary not to be confused, assess the patient's condition, and provide immediate first aid. There are two main types of bleeding: external and internal. External bleeding occurs when the blood comes from the vascular channel into the external environment. Internal bleeding develops when the blood is poured into the body cavity, internal organs. For example, in the intestines, stomach, uterine cavity. This bleeding is dangerous because you cannot see it immediately. It accumulates inside the body. Therefore, after falling, bruising, hitting, it is essential to pay attention to the following signs: marked weakness, giddiness, thirsty feeling, pale skin and lips, rapid heartbeat, frequent breathing, blood pressure drop, hemorrhage and soreness in the trauma area, victim's concern, nausea and vomiting, blackout, loss of consciousness. These signs are common for both internal and external bleeding. The cardiovascular system consists of heart and vessels. Vessels are arteries, veins, and capillaries. Through the arteries, blood saturated with oxygen enters the tissues. There, in capillaries, the gas exchange occurs. Oxygen remains in the tissues, blood collects carbon dioxide, and through the veins takes it back to the heart. Depending on the damaged vessel, bleeding may be arterial, venous, or capillary. Arterial bleeding occurs when the arteries are damaged. The blood color is bright red, scarlet, beats like a pulsating fountain because there is a high blood pressure in the arteries. The intensity of blood loss is directly related to the damaged vessel size and the nature of the damage. Arterial bleeding is the most life-threatening, as the victim can lose large amount of blood in a short time. Only immediate help will save a person's life. Venous bleeding occurs when the veins are damaged, characterized by slow, not pulsating blood flow, dark cherry color. This bleeding is also quite dangerous and can be relatively abundant. If there is a large veins damage, the victim's condition can be complicated by an air embolism. Air will get into the vein lumen and cause subsequent circulation disorder, which often leads to the victim's death. Capillary bleeding occurs when there is damage to small vessels of the skin. It is characterized by a small amount, slow, in the form of tiny droplets bleeding. Depending on the size of the damaged vessel, the bleeding can be weak and massive. Weak bleeding usually occurs with minor cuts, abrasions, and usually stops by itself. It does not always require medical assistance. Massive bleeding occurs when large vessels such as arteries and veins are damaged, and the victim quickly loses blood. During first aid for bleeding, make sure that you are not in any danger. Assess the victim's condition, determine consciousness and breathing. If the victim is unconscious, not breathing, and has massive bleeding, call an ambulance immediately or ask others. Wear gloves if possible. If there are no gloves, you can use plastic bags or similar waterproof elastic materials. Remember that you can contact with biological fluid, blood, and it may be infected. If you see small bleeding, such as a small venous or capillary, apply a clean bandage to the wound. Put a tissue folded several times on the wound, then fix it with a bandage or adhesive tape. If the victim condition allows, ask him to press the bandage with his hand, or press it yourself to stop the bleeding. Remember not to pull the limb too hard until the skin is blue below the bandage. If you observe massive bleeding, apply clean tissue or several layers of gauze to the wound, then put a roller on top. Applying the roller is necessary to squeeze the walls of the damaged vessels and block the bleeding. Then you should tightly bandage the wound. You can put your palm on the bandage to check it. If the wound keeps bleeding, place the second bandage above the first one without its removal. Make sure that the application fits the wound tightly enough. If the limb turns blue or dull, loosen the bandage slightly. You may also face the bleeding from the head area. There are many vessels on the scalp, and they are connected to the head venous sinuses, rich with blood. Therefore, the head wound's bleeding is very abundant and usually cannot stop on their own. First, to help the victim, sit or lay him down, as the bleeding can cause the loss of consciousness. Next, perform direct pressure on the wound and bandage it with a clean tissue. Sometimes, damage of the scalp's veins can develop an air embolism as a result of air bubbles entering the bloodstream, since the sinuses of the dura mater are weakly reduced. It also happens due to low comparing to the atmospheric blood pressure in head vessels. Therefore, to prevent such serious complication leading to death, you cannot change the original tissue. When the bandage is heavily soaked in blood, you should put a clean application above the first one, which can be replaced with a new one if needed. Don't forget to fix the second bandage. In everyday life, there may be accidents in which internal bleeding can develop. The first aid in case of internal bleeding is the following. If there is no danger to you, determine the victim's condition, consciousness and breathing. If the victim is conscious, try to provide him with complete rest and put him on his back with the roller under the half-bent divorced feet. If the victim is unconscious but breathing, move him to a stable lateral position. Ask others to call an ambulance. If there is nobody nearby, do it yourself. If you know the source of bleeding, you can impose cold on the probable area before an ambulance arrives. If you are using a bubble with ice or snow as cold, wrap it in some tissue to prevent the frostbite. Let's also stop at the nasal bleeding. In most cases, the reason for that is the feature of anatomic structure of the nose. The nose has a vast network on thinnest capillaries, which can be damaged even with minor changes in atmospheric pressure or under physical stress. During first aid, calm the victim. When a person is nervous, his heart beats more often, which increases the bleeding. If the victim can sit, sit him down and ask him to tilt his head forward, rather than throwing it back. In this case, you will be able to control the intensity of blood loss. Besides, blood can get into the esophagus, which will provoke vomiting, or into the airway, leading to suffocation. Press the nose wings with your fingers to the nasal septum, squeezing the vessels and stopping the blood. Squeeze it for 5–10 minutes. If the bleeding is not stopped, it is allowed to make a squeeze for another 10 minutes. If possible, apply ice to the nose bridge. The cold will constrict the blood vessels, reducing the hemorrhage. If you cannot stop the bleeding for more than 20–30 minutes, or the blood flows very intensively from both nostrils at once, you should call an ambulance. Suppose you were able to stop the bleeding. In that case, you can additionally offer the victim to drink something cold. Still, it would help if you strictly abstain from coffee and tea. They contribute to vasodilatation and can provoke the bleeding restart. Let's sum it up. You have learned what function the blood performs, what types of bleedings there are, their signs, and how to help the victim in various types of bleeding properly.